awkward conversations. It started with, I'm not sexist, but there's the CO2 level on the screen and it goes like this every time someone breathes out. And then hers was like this. And I was like, oh my God, she's not breathing. Like, this is alarming. Oh my God, she's not breathing. Like, what is gonna happen? Good morning. This week, I have my anesthetics week as part of my surgery rotation. So just heading into the hospital now so that I can be there in time for our 8 a.m. start. This is probably the most structured week of all of MD2 because this week we're actually assigned to a doctor and a theatre morning and afternoon every day of the week, which has never happened before. So I'm excited to have a little bit of structure and continuity. It's been a really strange few weeks because Melbourne has been in a lockdown again and now the restrictions have eased, but they're not all the way eased. You still can't have people over to your house. I have learnt from last year and last lockdown when I was trying to be really productive through the lockdown that it's just not feasible for me. I ended up being really quite depressed and was not enjoying myself at all. So while I haven't been very productive at all this lockdown, I still feel positive and optimistic, and I think a break from YouTube was very much needed. We were going to have exams in the next few weeks, a second set of OSCEs. You can think of the OSCE exams as an acting exam. So an examiner watches us take a history or do an exam on a real or acting patient, and then they assess us and our skills and how we're going doing that interaction. But they've moved our second set of OSCEs to, they've just cancelled them altogether, and our end of year OSCEs are going to be worth more now. So I'm not that thrilled about that change because it would have been nice to have more feedback this year. But anyway, that's the way it is. I'm still yet to scrub into any surgeries, which is such a shame. I've been trying really, really hard, but it is just luck of the draw sometimes, like who you run into that day, what kind of procedure it is, and I've just been a bit unlucky, I guess. Had a lab this morning about how to insert a nasogastric tube, which is a tube that goes from the nose through to the stomach. It can be used for feeding or for decompressing the stomach. Need a syringe, lubricant, pH strips, and a bandage. Here I am measuring the distance from the nose through to the stomach, so I know roughly how deep to go. Got some lubricant on there, so I'm just going to slip it into the mannequin's nose, push it all the way down. This is how to check whether or not we've made it to the stomach. We use a syringe to aspirate some fluid from wherever we've got the tube, and we're praying that we've made it to the stomach, right? We don't want to get into the lungs. So now I'm going to put the fluid, pretending like there's fluid there, into a cup. And this is where the pH strips come in. So we're going to dip the pH strips into the fluid and then check what pH it is. And the stomach is acidic, right? So we want to see that the pH strips tell you that the fluid is acidic. And there we go, pH of 1, pH of 2, which is acidic. Made it to the stomach instead of the lungs. Day one of anesthetics week over. It was actually quite challenging to be on my feet all day. I'm just not used to it at the moment, so my feet are killing me. It was overall a good day. I'm just going to pack my bags. I'm just going to pack my bag and I will speak to you guys in a sec. Hello, good morning. It is Tuesday. I am waiting in my car outside the hospital. I'm very, very early because I hate being late, and this is a new section of the hospital where I don't know where everything is. Yesterday was a really mixed bag of a day. The first case that I was on was a malignant melanoma removal. So a lady had a little melanoma that she was getting removed, and it was under local anesthetic with sedation. So I realized yesterday how little I know about anesthesia. The terminology is quite nuanced. So you can have a local anesthetic, which is something that you inject to block pain fibers in an area. So in the melanoma example, say if I've got a melanoma here, injecting straight around it, that would be considered a local anesthetic. So you can have a local anesthetic and then also be sedated, and then the sedation is on a spectrum. If you have drugs in your system that are making you sleepy and forgetful, but you are still breathing on your own, that is considered sedation. And on a spectrum of that, at the other side, you've got general anesthetic, where you have probably just more of these same drugs, the sedation drugs. But then as well as that, because you've got so much, you've got like a laryngeal mask airway in your airway to help keep your throat open. So that's what I spent most of my day yesterday wrapping my head around, the terminology about sedation versus general anesthetic versus local anesthetic. There's a third type of anesthetic, which I don't know which section it comes under. I think it might still be under, I think it might be its own category, which is regional anesthetic. If to block an area here, we put a block in my nerve plexus in my shoulder and knocked out my whole arm, that would be considered a regional anesthesia. Okay, so yesterday, my first case, the melanoma, it had a local anesthetic and the lady also had some sedation, but she was still breathing on her own. And I guess it was just a bit of a strange experience because sometimes in medicine you meet teachers or doctors who just don't really want to teach. So when I rocked up yesterday, the first thing that was said to me was, Monday's not a good day for teaching. I was like, all right, well, this is my timetable and I'm here now. So this is just not really making me feel all that welcome, but it was fine. It was a very short case. I'm not going to get too much into it, but it was just a little bit uncomfortable. I felt pretty uncomfortable all morning. And luckily I had a class at 10 a.m. that I had to leave for, and our allocation swapped in the afternoon. So we're with one anaesthetist in the morning and one in the PM. So that was fine. That was only a short section of my day. And then the second anaesthetist that I was with was super awesome. Just very, very, very nice person, very clear and encouraging teaching. He really talked me through like a lot of different things about those things that I just explained to you, the difference between general anesthesia, sedation, local, all of that stuff. The procedure that I was a part of with this doctor was a total knee replacement. I got to watch the whole process of them first prepping the patient and putting a spinal anesthesia in the patient, putting anesthetic in the person's spine so that they were all like knocked out from the legs down. He said it's separate from an epidural, but I don't know why it's separate from an epidural. We forgot to get to that, but it's different, kind of. And then we also talked about what is a normal amount of hemoglobin and in what instances you would do a blood transfusion. And I'm forgetting the exact numbers. I only know the rough numbers because it's different for men and women. But my rough understanding is about 120 moles per liter? Grams per liter? Oh, fuck, I shanked it. I think it's 120 grams per liter of hemoglobin, and it's also the anaesthetist's job to monitor the procedure and make sure that they're keeping track of how much blood the patient has lost so that if they need a transfusion, then they can make that all happen. This anaesthetist was also nice enough to show me how to don sterile gloves and gown as part of a scrubbing procedure, because I still hadn't learnt it yet. I just hadn't had the opportunity to, but they were really good at showing me how to do that. They taught me about this great concept called deliberate practice, which I'm really excited to implement into my life. So basically they taught me how to do the gloves thing. I did it a couple of times and they were like, okay, well now I'm going to time you doing it, okay? And don't stress, don't try to be as fast as you can. Just do it at your pace and make sure that everything's sterile and get your time. And then I did it and it was about 1 minute and 19. He was talking about how the difference between a really amazing doctor down the track and like an average doctor is the people who have put in the time to do deliberate practice and shave like seconds off their time. I need to illustrate the example. So let's pretend my jumper is a sterile gown that I've just put on. And I've got my arms in the sterile gown like this. And I need to create little puppets, little gripping puppets that I can use to grab the sterile gloves and then flip the glove onto my hand. So at the start of when he was showing me, I was doing this to grab the gloves. And he was explaining to me that it was better to have my thumbs like this, like all within the cuff, instead of having my hands like this, which this is easier. And I was really quite struggling to do that. So I was like, why do I need to make sure that I have my fingers within the cuff? Why can't I just have my fingers like this and make like bigger puppet? And then he was explaining to me about his own deliberate practices. And somewhere along the line, he realized that if he starts the donning of the gloves with his hands like this instead of lower down, it shaves about a second off his time of being able to put the gloves on. I thought that was a really cool concept and one that is going to be really useful to me, because I am definitely someone who I'm very sterile and very slow, because and rightfully so, I really care about maintaining sterility. But to move from me being slow and sterile to sterile and efficient, timing how long it takes me to do stuff and trying to improve how long it takes me to do stuff is going to be a really, really useful skill. It was actually a little bit scary to be an anaesthetist for the day, because, for example, in our first procedure, the doctor administered some anesthetic and the patient, she occluded her airway, which means that her tongue fell back in her throat and then she stopped breathing for a second. And so you're watching like this, there's CO2 level on the screen and it goes like this every time someone breathes out. And then hers was like this. And I was like, oh my God, she's not breathing. Like, this is alarming. Everyone else is super chill and super fine. It was just me internally being like, oh my God, she's not breathing. Like, what is going to happen? The anaesthetist got me to do the next part, which is just like tilting the person's neck back by holding like just underneath their little bone here. You don't want to occlude their airway anymore, but just on this bony bridge here. And you just have to tip their head back and hold it there so that their tongue gets out of their way. And in some other scenarios where that doesn't work, you grab them by the ends of their jaw and then thrust the jaw forward in something called a jaw thrust. But it was just crazy. I was like, oh my God, this person's not breathing. That's really important. People need to breathe. I was very impressed by everyone's ability to just be calm and collected, which is exactly what you need to do. But for an amateur like myself, it was like a conscious effort to be like that. I was asking the doctor like how long in a procedure you're supposed to just hold someone's airway open for. The drugs are designed to be very short acting. So say you administer an amount of drug and then the person is like unable to hold their airway open and you have to mechanically do it. The drugs have a half-life of about 7 minutes. So in 7 minutes, half of their activity is gone. So you'll only be holding it for like a few minutes. The person's breathing reflex will reinstate by itself. Oh, I'm excited to see what today has in store for me. I haven't really checked out what my procedures are. I just know where I am. So it's going to be a surprise again. Had a really great morning today. Got to put in a few laryngeal mask airways, which we've learned about in the labs, but it was pretty fun to do on a real patient, and also really useful because we need those in emergency situations, and it's pretty different doing it on a real life person versus a simulation dummy. So it was good to get some practice getting it in. I didn't quite get it all by myself. I just had a bit of difficulty getting around the tongue, and the anaesthetist helped guide me to do it. But hopefully by the end of the week, I'll be a professional at putting in the airways. There's a couple of anesthetic doctors on today. There's a registrar and a consultant, so there's plenty of people for me to ask questions to. The registrar is very, very funny, so that's been really good as well. I would describe anesthetics as like cooking in a kitchen with lots of different spices, and all of the spices work for different things, and you have to know which spices work for what and what ones are going to get you the best result in what situation. And in anesthetics, I guess not so much in cooking, there's a trade-off of safety as well. So for example, some things might be faster acting, but then they're a little bit more bad for people with kidney problems. There's a lot of nuance to how to put people to sleep, and it's very case dependent, depending on that person, their medical history, their allergies, their age, what the procedure is. So to me, the beginner amateur, it feels like there's just so much to know, and there is. But I guess after a point, it just becomes pattern recognition and you'd get a lot better at it. But it's been really fun and I'm really enjoying it, really considering anesthetics as a career. I think the only thing that is nagging in my mind is that someone told me, an anesthetics consultant, granted they were a bit jaded, told me that it's quite a solitary job, and I love people and being around people. So not sure if I would feel lonely or what. So I'm on a break right now because the morning theatre list is over and the afternoon one doesn't start till 1:30, and I'm feeling a little bit frustrated right now. I was having a lovely morning, loved chatting to everyone. Everyone was very friendly, great. Then I asked one of the anaesthetists why they picked anaesthetics as their specialisation. So they're telling me all the great things about anesthetics. I was like, wow, that's really cool. Thank you for your insight. Some of the perks were when you finish at 6, you do actually finish at 6, and then another anaesthetist will come and cover you and then you can go home, versus the surgeons who have to stick around till the end of their procedures. A couple of other perks, quite useful insight. And then Without my asking, the conversation turned to women in surgery. And like all good conversations, it started with, I'm not sexist, but always a good start to a conversation when someone says something like that. The person proceeded to tell me that they felt sorry for female surgeons, especially for orthopedic surgeons, because they're smaller and less physically able to do the surgery than the men. Secondly, because women have babies and they have to be on their feet all day, it would just be really difficult for female surgeons, and then they felt really bad for female surgeons. And then they said, well, female surgeons would have to really rely on their partner, which I rebutted with, yeah, like the male surgeons who rely on their partners. To which the anaesthetist was saying to me, oh, but like, you know, like biological functions like breastfeeding, like that's a female role, and that's like always going to be a female role. What fucking career is there where I can breastfeed on the job? Because there is none. I can't work in a retail store with a baby on the fucking counter breastfeeding. It's not happening. I will have to take a break to breastfeed, regardless of what my career is. And why should that exclude me from being a surgeon? To rebut the second point, orthopedics is the only surgery where you have to manipulate like a whole patient leg to do a procedure, but you're not moving it around the whole procedure. You're literally just placing it, and then you're using power tools. I know how to use power tools. Okay, whatever, that's one surgery. There's also many other surgeries that are tiny, and I think that being a small female with nimble little hands and great attention to detail would be a massive asset. You never hear about why women would make excellent surgeons. You only hear about why women wouldn't make good surgeons. And there is no conversation that's happening with men about why they shouldn't be in certain specializations. That conversation is not happening, and that is absurd. I did not ask what obstacles women will face in surgery, and to be quite frank, all of this conversation about why women shouldn't be surgeon is making me want to be a surgeon real bad. I just had the sweetest patient interaction, and it has honestly made my day. It's moments like these where you can make a difference to someone's day that makes medicine so worthwhile and so rewarding. So to set the scene, I was in the little anesthesia room off the main theatre, and there was a patient waiting in that room, and so myself and the anaesthetic registrar went inside, and I did the cannula successfully, might I say. And then we were just basically waiting around for the procedure to end that was already ongoing. And the patient mentioned that she was feeling anxious waiting for the procedure to start. I was like, oh, okay, sweet. Like, I'll talk to this lady while she waits to kind of ease her anxiety and to ease this anticipation. So we started chatting about her life. And then we started talking about her new dog that she got, which was very exciting. We were laughing about her being a dog mum and turning into the dog mum that she didn't think that she would be, which was very funny. And it was nice to see her distracted and not thinking about the procedure that was about to happen. Anyway, shortly after that, she goes into the theatre. They put her to sleep. Procedure happens. And then at the end of the procedure, they turn the anaesthetic off. They take out her airway tube, and she starts laughing. And everyone's like, oh, what? And she's like, yeah, I was having a dream. We're like, what were you dreaming about? She's like, I was dreaming about my dogs. And it just made me feel so good inside to know that I contributed to her feeling positive about this experience, coming to the hospital and getting a procedure done. I did 2 successful cannulas today, which I'm really, really stoked about. Normally in the past when I've done cannulas, I felt really sweaty because I've been so nervous. What normally sets me off when I do a cannula is when you take out the needle, blood can spurt out of the needle, and then I feel like, oh my God, holy shit, I've got to hurry up because there's blood pouring out of this person. But now I've learned how to occlude the vein by pressing above where the needle is so that blood doesn't just spurt out. And I just did that successfully. So I felt very calm during the cannulation because there wasn't a waterfall sea of blood coming at me. So that was a nice change. Okay, I'm actually having the best day. Yesterday when I was getting ready for bed, I was really dreading today, but it's honestly been so good. I just came home for lunch because I didn't bring any lunch today, and I don't have a class for another hour and a half. But basically this morning at 7 a.m, we had our long case shoot. So yesterday I didn't go to anesthetics because we only had to go 3.5 days this week. So I took yesterday off, and I basically spent the whole day yesterday on my long case. Honestly, it takes me so long to write them. And it really expanded to fill the amount of time that I gave it. I was feeling kind of okay about it. It was my first post-operative long case. So the person had already had a procedure. So it was finding my feet a bit about what is important to include in a long case for surgery. But my teacher gave me really, really good feedback. She thought it was a very good presentation. And that was really reassuring. And she also gave really constructive feedback as well. So I can see where to improve and I can see what's pertinent and what's not pertinent. So basically, yeah, I had a really good class. And then I went on the pain rounds with the anesthetics team as well. I'm having some leftover curry for lunch that I made the other night. And I was honestly thinking about it all day. I'm like, I just really want to go home and eat that curry. So I'm so fucking excited. I haven't eaten today. It's 1:30 p.m. I haven't eaten today because I went on the rounds this morning and I thought that they were just going to go for like an hour or an hour and a half because that's how long all of the surge rounds have been. But it ended up going for like 4 hours, which I wasn't expecting. So I'm hungry. Sorry, my phone was full of storage and I had to unload some of the footage that I had on there because I've been a bad girl and I've been filming and not editing. But so yeah, this morning I went on pain rounds and that was with the anesthetics team and we just ran around to all the patient beds who had had procedures and who needed pain relief just to monitor how their pain was going, because managing post-operative pain is really, really important because you want your patient to be up and moving, and if they're not up and moving because of their pain, that can be a real problem. So for example, there was a lady who came in and she had fractured a rib. She was an older lady. The pain management team was trying to make sure that they managed her pain sufficiently enough that she would keep breathing so she wouldn't go into respiratory failure, which would obviously be bad news. The team was exceptionally nice. I really enjoyed being on the team with them. I was myself and 2 other doctors and they were all so freaking nice. Oh, and then I also ran into Nina. Hi Nina, if you're watching this, who happens to work at the hospital that I'm at and who reached out to me because she follows me on Instagram. So it's such a pleasure to get to meet her. That was so lovely. I got some deliveries today that I'm so excited about. So this one's really dorky, but they are prescription swimming goggles. And I feel like I'm in the year 3000. These are so cool. Anyway, amazing. And my second purchase that came today is every med student's rite of passage, a silicone suturing practice mat. I've only sutured a couple of times in class and then in a workshop. So I really want to practice and get my skills up. I'm quite a good sewer, so I think it'll just be a matter of getting used to holding like the utensils, but the actual sewing part shouldn't be too challenging for me. I think I'm now going to sit around for about 10 minutes before I head back to the hospital. I should start editing my video. Actually, I'm just going to do it while I'm talking. I'm going to start editing my video for this week for about a few minutes and then head back to uni for my short case class to round out the day. So an unfortunate part of having doctors as teachers is that they're often busy at the last minute. So I just got back to the hospital to look at my phone, to check a message on our WhatsApp group to organize the tutorials, saying that our tutorial today is cancelled, which means I did not have to come back here. Could be at home right now. So I guess because I'm already here, I may as well use the library for like an hour and then go home and enjoy the fact that it's a weekend, even though we're in a lockdown. Don't know if I've mentioned this before. Holy shit, I haven't mentioned it. But we're in a snap lockdown as of yesterday, which has been putting me in a weird, funky mood. Oh, that's why I was upset last night, because we were in a lockdown and I don't know, I just wasn't feeling that good. Oh, and I got rejected from a job. That's why I haven't recorded for the last couple of days. Just wasn't feeling that good because lockdown does that to me. I'm a very social creature and it just takes me back to the time last year where I was locked away in my room, like rocking back and forth in fetal position. But we're trying not to repeat that scenario again this time. Thank you very much for watching, everyone, and I hope you liked this video. If you did, it would be awesome if you could like, comment and subscribe, as it really helps me with the YouTube algorithm. And I will see you next time I post. Stay safe,